In medical rounds over the years, there have been advancements made in the evaluation and treatment of heart rhythm disturbances, otherwise known as cardiac arrhythmia. Physicians who specialize in the evaluation and treatment of these electrical disturbances of the heart are known as cardiac electrophysiologists. And Dr. Mark Marab, the System Director of Electrophysiology Labs for the Hartford Healthcare Heart and Vascular Institute, is joining us live tonight. Good evening, Dr. Marab. Thanks for being here tonight.
Good evening.
Well, what are some of the types of heart rhythm problems that you often deal with?
Yes, we deal with many different types of arrhythmias or heart rhythm disturbances. Some of these are slow beats, some of these are fast beats, and the fast beats can come from the upper chamber, they can come from the lower pumping chambers of the heart. They can be benign or they can be very serious, such as atrial fibrillation, which can cause strokes, and some lower chamber rhythms can cause sudden death or cardiac arrest.
Most of us, doctor, have heard about pacemakers and defibrillators. How do they work, and are there any recent advances in these devices?
Yes, so these devices, pacemakers have been around since the late 1950s and defibrillators since the early 1980s. Pacemakers are typically used for slow beats, so they send a signal to the heart telling it to beat. Defibrillators do the opposite. They take dangerous rhythms disturbances and shock the heart back into a normal rhythm. The advances that have been made are, number one, they've gotten smaller over the years, the batteries last longer, they have more features such as the ability to record arrhythmias, and some neat advances include what we call remote monitoring, where we can monitor these devices from the patient's house directly to our office. That gives us a lot of data about their wires, the battery, and any arrhythmias. And they recently have become compatible with MRI scanning, so patients with these devices can now undergo MRIs, where in the past they could not do so.
Now, the technology is amazing. And what about, as long as we're talking about possible treatments, what about catheter ablation for cardiac arrhythmia?
Right. We have medicines that treat arrhythmias, but a lot of times they're not effective or have side effects. So we've moved to this procedure called catheter ablation, which means going in with a catheter or wire. We use a procedure called mapping, where we figure out where the arrhythmia is coming from, and then once we localize it, we move the specialized wire on top of that area, and we typically give radiofrequency to cauterize or heat or burn out that arrhythmia. Sometimes we actually freeze out the arrhythmia. So it's a very good technique. It's highly effective, and recovery is very quick.
That's good to hear. Now, what do you believe sets Hartford Healthcare Electrophysiology Service apart from others?
Yes, we have a great team here at Hartford Healthcare. First of all, we've state-of-the-art labs. We just built a third electrophysiology lab here at Hartford. We're expanding to Mid-State Medical Center, where we're building another lab, part of our Hartford Healthcare system. We have great dedicated nurses and staff that are dedicated just to arrhythmia patients. We have a pre-op and post-op area that monitor these patients before and after their procedure. We have great anesthesiologists that sedate our patients and make them comfortable. I have 6 great colleagues, talented, great doctors, and we have our administration has supported us. Again, we got state-of-the-art things such as 4 different types of mapping systems. It's just been a great experience.
Well, it sounds wonderful, and we thank you so much for joining us, Dr. Marab, for sharing this great information. And keep up the great work. May the beat go on for you. And if you'd like to learn more information about the Heart and Vascular Institute, call the number you see on the screen. In the meantime, Dr. Marab will be answering your questions live on the Hartford Hospital Facebook page, and that is happening right now.